Friends, we are again in midst of a pandemic, and this time the pandemic is a flu virus. We have been experiencing this symptoms of upper respiratory tract infection since the time of COVID and have been in panic. But this season, the flu has been of a different variant, and it has been because of a different virus which is called the Influenza virus. The Influenza virus is basically of 4 types, A, B, C and D. And what happens is the flu is usually caused in our human beings by Influenza A and Influenza B. Influenza A is of 2 types, which is H3N2 and there's another subvariant which is called H3N2. And these are the ones which we are seeing a lot common in our population nowadays in this pandemic. The C and D varieties do not occur in human beings. There are various other respiratory syncytial virus. COVID is still lurking here and there. So these are other viruses which are involved, but much lesser quantity. So basically all the flus that we see nowadays is influenza. It could be either Influenza A or Influenza B, and H3N2 is one of the type of Influenza A virus. The symptoms. There might be a lot of information regarding somebody having more of cough, more of cold, more of fever, more of body ache, but I would say all the flu viruses cause similar symptoms of upper respiratory tract infection, which involves cough, fever, body ache, headache, malaise and extreme fatigue. The only extra point this year that we are seeing is that the infection is getting prolonged. People are suffering for more than 3 to 5 days, it could go on to 7 days. And the cough gets prolonged to 2 weeks or so. The treatment, I would suggest that we do not indulge into unnecessary antibiotic treatment. We should actually consult a doctor only once the fever or cough persists for more than 3 days. Otherwise, we should take symptomatic treatment like paracetamol, maximum and anti-allergic, some steam inhalation. In case the cough, fever persist beyond 3 to 4 days or about a week or so and it becomes really incapacitating, we should actually visit a doctor and we should look into lung involvement by either doing a chest x-ray or an HRCT chest, and if that is normal, we needn't worry and by time things should do well. In case you have a report of Influenza A, either an H1N1 type or an H3N2 type or Influenza B virus type positive, then we could add Tamiflu 75 mg twice a day, that too by the help of a registered practitioner. Next, coming down to the prevention of flu, we could actually prevent flu by staying healthy, by eating healthy, by sleeping well and drinking a lot of fluids, taking care of not having too much of junk food and staying away from people who are actually having flu by using masks. Thank you very much.